success with an at-home COVID treatment regimen. KOIM's Zach Dodge. After more than a year of the pandemic, there are only a few treatment options authorized by the FDA. But now a healthcare provider in Fort Scott says they've seen success with an at-home COVID treatment regimen. KOIM's Zach Dodge has details on that at-home protocol and what top health officials say about the effectiveness.
In a small family practice in southeast Kansas, a healthcare provider claims to have found a better way.
I've seen probably close to 50 at this point. Small sample around here.
Ryan Lewis spends his time divided between being in the military and being a nurse practitioner at Fort Scott Family Medicine. He says his military background drove him to find a way to save more lives.
I'm not a put myself type of person out there, but when family or friends or people you know die.
Now he claims to have found a way to treat COVID-19 so patients don't land in the hospital.
A lot of this at the first came from Dr. Peter McCullough down in Texas.
He prescribes vitamin C, D3, and zinc, as well as medications like aspirin and berberine when symptoms are mild. If they get more severe, he adds prescription medications, including ivermectin and hydroxychloroquine. Then he monitors their progress. Of the roughly 50 patients he's treated,
only one has been hospitalized. 2 had to go to the ER. That's it. Everybody else has had complete and full recovery.
But many parts of the protocol are not backed up by the nation's top disease experts. The National Institutes of Health say there's not enough evidence to support vitamin supplements' effectiveness in preventing or treating COVID. It's the same for all of the medications in the protocol, with the FDA specifically warning not to use ivermectin or hydroxychloroquine. They say ivermectin can have dangerous interactions with other medications even when taken at normal doses, and that hydroxychloroquine has been linked to serious heart rhythm problems and other safety issues.
How confident are you in there not being adverse side effects?
So let's not get into a political discussion because that's not what this is about.
Right.
But from what I have seen, I can't argue with the results. From what I hear from other providers that have done the same thing with a much larger patient base and good results, I can't argue with that.
In Fort Scott, Zach Dodge, KOAM News.
We're going to have a more in-depth breakdown of what Lewis uses in the protocol and what other experts say about them in our website later tonight. That's KOAMnewsnow.com.